Hi everyone, this is my presentation on cervical length ultrasound. My name's Emily Bach. I'm a women's health nurse practitioner student at Regis College. Description and history. Cervical length ultrasounds are used to determine the cervical length measurement. It's done via a transvaginal ultrasound in the second trimester, typically 16 to 24 weeks. It's done to assess the cervical length, which is measured from the distance from the internal os of the cervix to the external os of the cervix. A short cervix is typically less than 25 millimeters, and that's associated with preterm labor as well as preterm birth. As far as the history of cervical length measurement, cervical length ultrasounds, I wasn't able to find a specific history, but there's a lot of evidence showing that it's been utilized for quite some time. Recommendations. Currently, there's no universal consensus on cervical length ultrasounds. The American College of Obstetricians and Gynecologists recommends that singleton pregnancies in women that have a past medical history of preterm labor or preterm birth be screened for cervical shortness or a short cervix via a transvaginal ultrasound routinely starting between 16 and 24 weeks. They haven't mandated a universal cervical length screening in all women, but they are considering it. Also, the Society of Fetal Maternal Medicine also has the same first recommendation as the American College of Obstetrics and Gynecologists, where they recommend that women who have a history of preterm labor and birth that have a singleton pregnancy be screened for short cervix via the transvaginal ultrasound at 16 to 24 weeks. Specificity and sensitivity. There was a wide range. Different studies found different specificities and sensitivities for cervical length ultrasounds. One study I found was actually unable to report a specificity and a sensitivity because they said the measurements were unreliable, meaning that different ultrasound techs were getting different cervical lengths on the same patients. Other studies reported very high specificities of up to 99.9% for preterm birth before 34 weeks if the cervical length was 20 millimeters or less. And then other studies reported that the highest sensitivity and specificity for preterm birth before 34 weeks was a cervical length of 25 millimeters. And most studies do report that a short cervix is 25 millimeters or less. So it seems to be the standard number. Indications and contraindications. So for indications, as I mentioned, women that have a singleton pregnancy who have a past medical history of preterm labor or preterm birth are recommended to have a cervical length ultrasound at 16 to 24 weeks. There are many women's health advocates that are currently advocating for routine cervical length screening in all women who don't have any of the contraindications I'm about to talk about. For contraindications, it's not recommended that women with placenta previa, premature rupture of the membranes, meaning their water is very broken, multiple gestations, or women that have undergone treatment for preterm labor, which is a cervical cerclage. The procedure itself is generally well tolerated. It's typically fast, under 15 minutes. It's typically pain-free, or they have mild discomfort with it. How the procedure works is a woman will be asked to empty her bladder. She'll be placed in the lithotomy position. The ultrasound probe will be inserted into the vagina. They'll obtain a sagittal view of the cervix, and they'll measure the endocervical canal, which is from a distance between the internal os to the external os. Advantages. There's a lot of evidence to suggest that short cervical length is associated with preterm labor. And there's evidence to suggest that the cervix shortens or changes before symptoms of preterm labor come on. So this, based off the evidence, it's suggesting that these ultrasounds can predict preterm labor, so interventions can be implemented before these women have their child premature. One study reported that short cervical length resulted in a preterm labor before 34 weeks 74.3% of the time, while women that had normal cervical lengths went into preterm labor 2.9% of the time. And then as far as pregnancy before, labor before 37 weeks, women that had short cervixes, 100% of them gave birth. So 0% of them went into labor as a term pregnancy. And then regarding women with normal cervical lengths, they had an incidence of preterm labor of 25.8%, but a term pregnancy rate of 74.3% of the time. So an advantage of these ultrasounds is that we can better identify women at risk for preterm labor and preterm birth, so they can be better prepared. They can be transferred to a hospital and get their prenatal care that has a high-level NICU. They can get steroids to help mature the baby's lungs, or they can apply interventions like getting progesterone or doing the cervical procedure to prevent preterm labor. And this helps reduce maternal mortality rates, morbidity rates, as well as infant mortality and morbidity rates, and helps increase cost savings on healthcare. Disadvantages. Because of the measurement inconsistencies or errors in measurements that we've been finding with ultrasound techs, like where different ultrasound techs are getting different cervical lengths, that could be a concern for falsely identifying women at risk for preterm labor when they're not, and that could be putting them through extra stress, extra procedures, extra interventions that aren't necessarily needed. In terms of the ultrasound itself, some women may find it uncomfortable and possibly embarrassing or even painful. As I mentioned, it's contraindicated in women that have either placenta previa, where it can cause an increased risk of bleeding, premature membrane rupture, because it can increase the risk of infection, and then women that are carrying twins or more, and then women who have undergone recent cervical procedures to help prevent preterm labor. But overall, it is safe for mother and baby. It's just there's the increased risk of infection or worsening bleeding. Interpretation. So a normal cervix in a woman who is between 16 and 24 weeks pregnant should be about 30 millimeters. They have found at 22 weeks gestation, women's cervixes average around 40 millimeters. You're considered to have a short cervix or an abnormally length cervix if it's 25 millimeters or less at 16 to 24 weeks. So follow-up interventions could possibly be progesterone, undergoing the cervical procedure to help prevent premature labor, a pessary. Bed rest is not indicated for preventing preterm labor. That's been proved to be an ineffective intervention. And then as far as preparing women that are at increased risk for preterm labor or birth, it could be the steroids to help mature the baby's lungs, and then as helping get the mom to a higher level of care where they have a more prepared NICU. Teaching and counseling. So it's important to teach the woman signs and symptoms of preterm labor / when to call her provider. So regular contractions more than 4 an hour, a low backache, increasing pelvic pressure, and any vaginal bleeding or leakage. It's also important to teach her about the different treatment options that I discussed earlier, such as like the progesterone that can be an IM injection, or that can be like a vaginal suppository, and then also needed follow-up, because if she is at risk for preterm labor, she is considered a high-risk pregnancy and will need additional follow-up. These are the references I used. I hope you learned some information on cervical length ultrasound, and I hope you enjoyed my presentation. Thank you.